Hello, and thank you for visiting our website. We would like to be the compass that helps guide you on this journey as you search for answers, solutions, and treatment options. Hopefully, this will provide you with enough information to assist you in your choice of battling this disease. First, the bladder is a softball-sized organ located in the pelvis. It distends to allow urine to be stored and contracts to expel urine or urinate at the appropriate times. Bladder cancer is diagnosed in approximately 350,000 people per year, and men are 3 times more likely than women to be diagnosed. It is usually diagnosed in the 6th to 7th decade of life. Symptoms usually include blood in the urine, painful urination, burning during urination, and frequent urinary tract infections. Staging, which defines how aggressive the cancer is, the level of invasion, or if the cancer has spread to other organs, is important in developing a plan for treatment. For cancers that have invaded into the deeper layers of the bladder, surgical removal of the bladder, or cystectomy, along with removal of lymph nodes and the creation of a new pathway for urine to be stored and leave the body, has become the gold standard for treating locally invasive bladder cancer. In men, this not only involves removing the bladder, but the prostate and a part of the urethral tube as well. In women, however, a part of the vagina is removed, as well as the uterus, ovaries, and any other remaining organs. Historically, the open procedure requires a large incision. The procedure is complex, requiring many steps, and can take up to 6 to 7 hours to complete. Patients can have significant blood loss, requiring transfusions, several days stay in the intensive care unit, bowel complications, hospital stays around 7 to 9 days, significant pain after surgery, and a return to normal activity up to 6 months. There are several options for creating a new pathway for urine to be stored and to leave the body. The 2 common types are an ileoconduit or creating a new bladder. The ileoconduit is where the tubes that drain urine from the kidneys, the ureters, are connected to a small piece of intestine, and this is brought out through the abdominal wall and urine drained into a bag. This is the more common option because it is easier for you to manage and has fewer complications.
I had no problems after that as far as soreness was concerned. I had no pain to amount to anything. I was very pleased with the robotic surgery. I don't have any scars, got one little one, and that's about it. They removed my entire bladder. I have a bag outside and everything, ostomy, and it's fine, working fine.
The next common option is creating a new bladder or neobladder. This procedure requires a larger portion of small bowel to be configured into a cylinder object. The ureter tubes are then connected into this new bladder, and the new bladder is then connected to the residual urethra. The option is more complex, requiring more time in the operating room, has more steps to the surgery, and has more associated complications. The advantage, however, is that you won't have to wear any external appliance bags.
There is nothing external that I have to wear. Everything that was done internally. I did, due to the location of the bladder, I had several other organs removed as well. That did not cause any problem. The scars are very minimal. You can barely see them. It's like having laparoscopic surgery on your knee or anything else. They're very minimal, and I attribute that to the doctors here. They did an excellent job.
Here at Urology Centers, we employ the state-of-the-art robotics for the care of our patients requiring a cystectomy. We are able to utilize the advantages of the Da Vinci system, which includes small port incision, 3D high definition and magnification vision, and better surgical dexterity and precision. You are able to experience less blood loss, less pain, quicker bowel recovery, which means you're eating sooner, shorter hospital stay, and quicker recovery. Again, we would like to thank you for taking the time to visit our website. Should you have any questions, our contact information along with our scheduling information is provided.